for you today?
So yesterday I was cycling, then I had a minor accident and I sprained my ankle. And I read online that there's a painkiller called naproxen that is safe and effective for pain relief. Can I get them today?
Okay, so like what symptoms are you experiencing at the moment?
My ankle's a bit swollen.
Okay, so other than that, right, do you have any medical condition?
I'm diagnosed with bipolar disorder.
Okay, have you tried any medication for that condition?
I've been really given this medication called lithium that's as a mood stabilizer, 600 mg that I take twice a day.
Okay, so regarding your first question, right, I will actually discourage you to take naproxen because it's an NSAID lah, and it actually increases your lithium levels in your body, which will increase the risk of serious adverse effects such as like confusion and tremors, something that you wouldn't want. So I would maybe recommend you to get Anorex instead. I think it will be a better painkiller for you. Any other questions?
I wanted to know more about lithium side effects and how to manage them.
Okay, so there are actually multiple side effects that I can roughly go through with you. So firstly, it will be nausea and vomiting. So for this side effect, it will be best for you to take this medication with or after food so that you can, counter the nausea and vomiting side effect. Also, maybe can like take some simple meals, avoid like any like spicy or rich flavored food. Yeah. Second, side effect will be thirst and dry mouth. So maybe you can suck on some sugar-free hard candy or some ice chips and sip on water regularly to counter that side effect. Next will be like diarrhea, so it's best for you to drink plenty of water so that you can replace the loss of fluids when you have diarrhea. And next will be like headache. So if it does get bothersome in your day-to-day life, you can speak to your doctor about it and they can counsel you from there out. Yeah. So these side effects that I listed, right, it will improve over time, but if it come to find out that it does continue or it gets worse and it's affecting you, right, you can speak to your doctor about it.
Okay.
Any more other questions?
Yes. So I want to know about lithium toxicity. Like what is it and what are the signs and symptoms?
Okay, so for lithium toxicity, right, it means that you are having too much lithium in your body. So there's too much of the lithium that is in your prescribed medication. So some signs and symptoms that you will experience, if it's early symptoms of acute lithium toxicity, you will get like nausea, vomiting, diarrhea, abdominal pain. These symptoms will develop within 1 hour after you take a lot of lithium. If you have moderate or severe lithium toxicity, then you will get like mental state change that will range from like mild confusion to delirium, which is like delusional, uncontrolled shaking like tremors, and like some muscle twitches as well. Yeah, so those are like some signs and symptoms. Yeah. Any other questions?
Any other practical point which I should know about when taking lithium, such as administration, special dietary consideration, and drug interactions?
Okay, so for administration wise, do take this medication twice daily. This medication can be taken with or after food so that you can reduce the stomach discomfort. So because this tablet is a controlled release tablet, right? You must take it whole or half. You don't chew or crush it, and don't change the brand of this medication that you are taking without telling your doctor lah. And this medication needs to be taken regularly for a few weeks before you can feel its full benefits. So don't stop taking this medication even if you feel like it's not getting better. You have to continue taking and you will do experience the benefits like later on. Some precautions you can follow would be that if you are taking any other medications such as over-the-counter medication, supplements, TCMs, like traditional Chinese medicine and herbal remedies, right? Some of them will actually affect how this medication work or can cause like serious drug interactions. So you do want to avoid those. And for special dietary considerations, you can maybe try to start on a low salt diet because it may affect the way this medication works. It's also important to stay well hydrated while you're on this medication because if you drink too much or too little water, right, it can actually affect the lithium in your body and this will cause like any unpleasant effects. So if you're exercising, if it's a hot day, you drink a lot of water lah. And if you have any infection or illness that cause like heavy sweating, vomiting or diarrhea, do consult a doctor and continue to drink like plenty of water. That's all. Do you have any other questions?
No, that's all. Thank you.
Okay, thank you so much.